Let's get started. Hello, hello, hello. Welcome to Partners in Health's April Health Justice Call. I am Allie Bloomgarden. I am the Advocacy Engagement Manager at Partners in Health US, and I will be your host for the next hour. Just so everyone knows, this is being recorded and will be posted on PIH's YouTube. Almost all of our past health justice calls are now on there. We can put that link in the chat so you can always easily find it, share it. If you're like, wow, everyone needs to listen to this, feel free to share it. And my colleague, Lucas Allen, will be helping in the chat, collecting questions, letting me know, etc. So while I'm eager to get started, we have some quick housekeeping. So let's just go through those quickly. As I said, this call is being recorded. You are invited to turn on automated captions. Lucas, if you could go to the next slide, please. You can see in the instructions here on the slide where you're sharing the transcriptions, etc. So hopefully that will be helpful. This call is closed to the press, so if you're here with the press, I'm kindly asking you to leave. You are welcome to individually reach out to the speakers or participants for comment at your leisure. Please subscribe, which we'll put in the lit chat, to the Health Justice Calls emails for invites to future calls. Our next call will be June 27th, which is coming up already, crazy. And feel free to put Q&A in the chat. The speakers and I will get to them if we have time. If not, we can email you about them. And speaking of, if anyone has other resources that they want to share, please, or related contacts, please feel free. Everything, just throw it in the chat. So next slide. Now for why we are all here. Today, we're going to be learning from victory. We're going to learn from defeat. And our movement has certainly had enough of both. The movement for health justice has had so many incredible wins and victories. And this call is going to focus on some of those victories and what we want to learn from them and what we have learned from them. There's so much that we're fighting against. And it's really important to not only celebrate our wins, but learn from our wins. And so here is a time for learning and celebration. Well, also, it's good to learn from defeats, and we'll save that for another call. I'm so excited that we have some really powerful voices joining us today. I also really want to say that these voices are not a representative sample of the hundreds of thousands of people fighting in the movement for health justice, who span a range of identities, knowledge, lived experience, and nor do we expect these speakers to represent all these views, but they're going to share their learnings and experiences with all of you. Again, you can ask speakers questions in the chat. We'll address them if we have time. The goal for this call is to inspire thoughts, strategy, actions. So we encourage questions, curiosity, openness. Before I introduce our panelists, I also just want to make a couple of points that I want to cover at the top, because as I said, there's so many things that our movement is fighting right now, and we cannot get to all of them. So many issues at stake, so many human rights at stake. But for things that are happening really right now that I wanted to pinpoint, the battle over reproductive justice and abortion, in particular, medication abortion. We've had some speakers on the past few calls speak about this. Check those out on our YouTube. We don't have too much new to say about this, but there are so many organizers who are doing amazing things. There are so many sources. We can put them in the chat. We can send them afterwards. But we really just want to remind everyone to pay attention. Whether or not reproductive justice is your issue, reach out to a group and say, how can we help? Because our movements, our fights are interconnected. A whole lot more is riding on this than just whether it's medication abortion is legal, and medication abortion is big enough. So the next thing, issues of healthcare are always going to be at the forefront, regardless or not the US pays its debts. And we know there's a lot of conversations right now about the debt ceiling, and we're all going to be involved in it, or at least, I certainly hope so, given all of our fights intersect with health justice. And perhaps we'll have some more on that on the next call, but I just wanted to put those up top. And again, so many other issues that we just can't even get to. So we have things to learn and so many things to celebrate. As it turns out, so many wins. We have a big national step that Shaina will be speaking to. We have a big statewide step and win that Abby will be speaking to, and a big local step that Amalia will be speaking to. Each of these speakers, each of these campaigns, each of these stories deserve a full hour plus. So we really hope you get in touch with and follow all of these groups because they have so much more to say than we have time for today. But without further ado, please welcome Shaina Kasper from T1 International, who will be talking about the exciting win for affordable insulin across the US and what's next. Please welcome Abby Carter-Emanuelson, who is the Executive Director of Care for Carolina, who will be talking about the exciting win for Medicaid expansion in North Carolina and what's next. And please welcome Amalia NietoGomez, who is the Executive Director of Alliance of the Southeast in Southeast Chicago, who will be talking about the incredible win for the Stop General Iron campaign in Southeast Chicago and what is next. So let's get started. We're going to start with one that got a lot of national publicity, and that is what the headlines were saying: change in the pricing of insulin. So that was a month or two ago, and most of us probably haven't even paid attention enough to all the details of that and how this campaign reached the point after years and years and years where in a matter of weeks, the pricing and cost structure of insulin changed dramatically. I have provided these questions with the panelists already, so no gotcha questions, just so everyone feels prepared and ready to speak. So Shaina, I'm going to pop it to you first. Can you tell us, from the point of view of an organizer of a campaign, what was your approach? How did you come up with it? What did it take to win?
Yeah, hi. Thanks so much for having me. Great to be on this call. My first time being on this call. I'm looking forward to many more. So yeah, I'm Shaina Kasper. I'm the policy manager with T1 International. We got our start back in 2013 in the UK as this volunteer-led organization because 2012, 2013 is really when the price of insulin was just starting to skyrocket. And then in 2014, the Insulin for All hashtag really just kind of exploded on World Diabetes Day. And you've probably heard all of the talking points. Insulin's first patent was sold for $1 because it should be available to everyone. And instead, it's just become the poster child of pharma's greed. And there are over 7 million people just in the US who are on insulin, and everyone knows someone on insulin. And if that person is vulnerable and authentic and willing to share and ask for help or open themselves up for that re-traumatization by sharing about their experience, folks know what their loved ones have had to go through to get those vials of insulin that we need. And so, yeah, I came to this work in 2021 as a patient myself, and from 10 years in the environmental health field as a community organizer on the ground in my home state of Vermont. I really did a lot of work on drinking water contamination and fossil fuel infrastructure and just bringing together these unconventional allies, and got really used to winning there. And I was just shocked by coming into this movement of how everyone wanted insulin affordability. I didn't have to convince anyone about why insulin access and insulin affordability was important. And so I was like, all right, I love to win. Let's get in. Let's get this victory. Let's nail it down. But I thought going up against big pharma or big DuPont and Eversource was really hard, but going up against big pharma was really outrageous. So, okay, so what is the victory? Folks have probably seen that Eli Lilly, Novo Nordisk, and Sanofi, which we call the big three, they've all lowered the list price of some of their insulins. And this is really momentous because this is the first time that these big three have given in to this tremendous pressure from the grassroots, despite all of this lobbying and power that pharma is holding. There's still a lot more to be done. And the media I feel like is saying that this fight is won, that all patients will have access to insulin for $35 a month. And we do really want to celebrate this moment that pharma blinked, and we want to kind of work to capitalize on this. And we still have so much more to do. And so kind of how we got here and a little bit about what's next. what it took to win and what's next. So at T1 International, yeah, we're, transparent, independent from big pharma, which I found is, pretty rare among our peer organizations, and run effectively what's a nationally distributed field organizing campaign for insulin pricing. So we have 41 state insulin for all chapters, which are largely autonomous in their goal setting, endorsing legislation, taking action, holding meetings, things like that. We have 5 US staff for these 41 chapters. So, really it has to be. So we really attempt to maintain like a collective message and strategy by having a really rigorous onboarding process and a grassroots patient advocacy training curriculum, and then having a few priority campaigns that chapters can work on together. So we meet with chapter leaders one-on-one for mentorship and coaching, and have these like regular calls with our key volunteer leaders, people with roles kind of in the chapters and in the organizations. And so for our priority setting, we have a federal working group, and we're shifting some of our state strategy work to include a state chapter campaign working group. And then we also do have we're a global organization. I'm mostly talking about the US, but we have our global advocacy priorities working group as well. And these groups really set our priorities, set our strategies, lead on our tactics and our actions. And as a member-led organization, we also have a couple of other spaces to ensure that our work is centering those most impacted by insulin access issues. So we have a communities of color space that advocates for, from historically, racial, and ethnically excluded communities to build that relational community and to inform the direction of our work. And then we also have Families United for Affordable Insulin, which is made up of folks who have lost a loved one from insulin rationing, and then our global advocacy network as well. And, we also offer monthly communication calls. I'm sorry, I'm trying to check the chat here. I don't know how I'm doing on time. We have monthly community calls, so where we kind of bring everyone who's interested in the movement, want to come together to take action, learn about the issues, be trained up on organizing skills. And then we also offer periodic mental health support calls for our advocates. We really want to set this strong culture of care and community because, as you all know, this work is really hard. Living with diabetes is unrelenting, and organizationally, culture eats strategy for breakfast. So we also rely on, academics and legal support and public interest partners and collaborators who support our vision and our mission and our values, and our campaigns. So yeah, we've prioritized 8 campaigns to achieve our vision. So the first one is our global advocacy priority, that no one should be spending more than 5% of their median income in any given country for people with diabetes by 2025 for insulin and other drugs. In the US, that's about $213 a month. So that really means that we need to set a regulated list price of insulin and other drugs in order to make any progress towards achieving that global priority. And then our other federal campaigns include patent reform and then tax reform. So happy tax day, everyone. And then at the state level, we've also got emergency access to insulin, expanding pharmacist scope of practice, expanding public pharma, so public production of insulin, public insurance, things like that, and then formulary reform, so stopping non-medical mid-year plan switching. And so kind of throughout all of these goals, our target, our priority is big pharma. We know that PBMs and rebates share a part of the blame when it comes to affordable prescription drug pricing, but our organizational focus is just so much on the list prices set by the manufacturers, really thinking that that is the root cause of this crisis. So yeah, one of Big Pharma's tactics is just to shift the focus away from those high prices to the role of PBMs and not wanting to, have too many targets or focus on too many different things. So we're really focused on prices. Patients without insurance or in high deductible plans should be able to get be able to afford list prices with dignity. And that we want policy change, right? So pharma just lowered the cost of these prices now, but we have seen again that they're going to raise those prices again. And so and that they're going to be coming out with new list prices that are going to be, new drugs with high list prices. And they didn't lower the prices for all drugs, as I'm seeing in the chat. So we need to set list prices for all insulins. We need to set them for all drugs, and we need to have actual laws passed to hold big pharma to account for lowering these prices and to lower them across the board. So I have a lot more to say, but I'll hold off for there. Yeah.
Thank you so much for all of that. It was really great to hear so many of the things that you all have done to set up your strategy and also to support your advocates. The mental health support, I think, is so critical, and we so often overlook that. Even internally, I think a lot of us in the health justice movement advocate for mental health support, but what are we doing internally with our people around that? So I just wanted to highlight that. I thought that was really wonderful. And thank you also for teeing up, which I'll ask in a little, about what's next. But before we get there, I'm gonna hop it over to Abby. So Abby, the national focus on expanding Medicaid was a while ago. In fact, a lot of states did it, and a lot of the healthcare movement moved that issue down their list because we had other issues to talk about and work on. But there's still really a rule in organizing that things don't move evenly or in straight lines. And so while other folks were moving on to some other fights that are important, there are states that didn't expand Medicaid and you all didn't give up. And because they didn't yet, you all fought and you won Medicaid expansion in North Carolina. And there's so much that we can learn from you. So same questions I asked Shaina. Can you tell us, from the point of view of an organizer of a campaign, what was your approach? How did you come up with that? What did it take to win?
Well, thank you, Allie, and it was great to hear Shaina's work. So Care for Carolina came together about 8-9 years ago in anticipation that it was going to be our year to expand Medicaid. We were expecting a favorable president, a favorable governor, and we got one out of the two. And so we really organized. And well, I've only been with Care for Carolina for as a staff member for the last 2 years. I was an original coalition member, stakeholder, and steering committee. So I have been part of it in all forms of the coalition, and now I'm currently leading the coalition. But it took a lot of convincing of our legislature. And so to build up to this victory, which is we're cautiously optimistic that it's going to stay a victory. But you're right, Allie, everything was, there was, between then and now, there was a lot of issue fatigue. Our advocates kind of slowed, we're like, why are we still doing this? It's never going to happen. But the organizers of Care for Carolina and folks that started coming together for this really leveraged all parts of organizing, whether it was polling about the importance of Medicaid expansion in our state. But we didn't even call it Medicaid expansion. That's part of the I don't know, trick, if you will, but we just started saying Medicaid expansion in North Carolina last year when we had some momentum change. We've been saying close the coverage gap, close the health insurance coverage gap, just so that people would not feel that they were buying into Obamacare. But I think everybody knows that this is the ACA now, and that was part of the work. So the organizing we spent a lot of time featuring those that were going to be impacted from the very beginning, those farmers, veterans, faith leaders, small businesses would be leading. We featured farmers and law enforcement and Republican county commissioners into our work. We held prayer breakfast so that we could gain more conservative legislators as part of that work. We talked about in our polling the importance of the lack of diagnosis and treatment for those that are with cancer and heart disease and diabetes care. And then as the organization moved on, we really found that those messages were key, that veterans and the coverage gap rural hospital closures and federal funding coming back to the state that the state was already putting out in our federal money were the reasons why the popularity of Medicaid expansion. And talking about that issue fatigue, even our champions had issue fatigue and concerns in that it wasn't until because they were battling among their caucus and between the North Carolina House and Senate. They just had a lot of fatigue, but once things were starting to move and we saw that we could find and identified a Senate champion, we secured lobbyists and began moving the Senate. That was really the key part of the victory. And with that, more organizations started coming together. We really made the case for the economics of health access. And we really know the fact, like we just really built on that to get to a legislative victory. And it's just been, it's almost like Lucy and the football. And as you all know, it's like we thought we were really close, and then it's Lucy and Charlie Brown in the football rather. And we would get really close and then something would slip out. And that happened last year, right at the end of our legislative session. Both the Senate had passed full expansion, and then the Senate, then the House passed a partial expansion with the delayed time. And then we got to the part where the session ended and nothing was compromised on. So at the beginning of this year, following the 2022 election, we were started to feel like this was it. We were hearing the momentum, and then and things just really did move. But it spent a lot of time getting to know the 20+ new members of the legislature that had not been part of this work, even though they did know somebody with in the living without health insurance due to cost. They didn't necessarily know about the whole program. So that has, so we got to that point. We're really thrilled that the legislation was signed into law last month. We still have some sticking points with regard to our a budget having to pass, but that seems to be, there's some momentum in getting that done before the end of the fiscal year so that we can have full expansion and be the 40th state to have expand Medicaid in the US. And hopefully with that work done, we will have some of those other Southeast and Western and Midwestern states will follow right along, because there's still 10 more out there and millions of people that are going without.
Yes. Oh my gosh, Abby, thank you for everything you just shared. So much to learn. And you know, it's a long fight, and you shared that. And even I remember last year, actually, we had someone from Care for Carolina on the call last fall, and so close to a win. And then there are just obstacles, and I'm so glad that we're all here today to talk and share lessons learned, because it's not linear. And it's also really wonderful to learn from people who have had these successes and taking notes and what you all did and how you kept track and kept people engaged with the fatigue. It's quite overwhelming. And I just also want to say, with our three panelists, like we have a national voice, we have a state voice, we have a local voice, and wins. And you all work in different spaces, and yet all of our fights are so intrinsically linked, and there's so many lessons that we can learn and apply. And everyone here works in health justice, cares about health justice. And so how can all of us take these lessons and apply them? So now to Amalia. You helped run, among many things, the Stop General Iron campaign. For the few of us who don't know about this campaign, it was an environmental justice campaign against a poisonous company. It's a textbook case of environmental racism, where a company is choosing to move their poison to a low-income, multiply marginalized community that is already experiencing environmental racism and health inequities. I know we use the term healthcare justice a lot, but sometimes we don't see the connection between healthcare justice and health justice and environmental justice. And these are intrinsically related. And it's so important that for all of us here to remember what is happening in each other's spaces and learning our lessons and working together. So, Amalia, I asked the other folks the same questions, but can you tell us from the point of view of an organizer of the campaign, what was your approach? How did you come up with it? What did it take to win?
Thanks, Allie. My name's Amalia NietoGomez from the Alliance of the Southeast, or we go by ASE for short. And we have a coalition called the Coalition for a Southwark CBA that actually worked on the Stop General Iron campaign. So we're on Chicago's Southeast side, and we are dealing, so shout out to all the Chicago folks. So we are dealing with a lot of pollution with legacy from the steel mills. We still have a manufacturing district, one of the few in the city. And we've had a lot of proposed developments in the last 3-4 years, even during COVID. And about half of them are toxic. So it's in that context that we start working on the General Iron campaign. We also, the other context is that we have a lot of health impacts. We have high rates of asthma, we have high rates of cancer, and that is very much related to the legacy of pollution, but also what is still happening in our communities. So we have high rates of asthma, high rates of cancer, high rates of diabetes, which I know was mentioned earlier, but we have a lot of health issues. So it's in that context that we started fighting against General Iron, and General Iron is a recycling company that has a history of air pollution violations with both the state, the Illinois EPA, as well as the city of Chicago. And General Iron is moving from mostly from Lincoln Park, which is mostly white, affluent neighborhood, to a working class minority neighborhood, mostly Latino, mostly Mexican, immigrant Mexican American community, as well as African American communities, kind of where all the communities come together. And Lincoln Park residents have been trying to kick out General Iron for years because it's right next to their residences and they're very much impacted by the air pollution. So our approach, like I said, we already had a coalition that was working on developments, trying to get agreements with good developments. And so, like I said, about half the developments ended up being toxic. So we have a multicultural, multi-generational coalition. We partnered with a lot of environmental groups, and I see one of them is on today, the Southeast Environmental Task Force, which led the Stop General Iron Coalition that we are a part of. So we had our own coalition, and our coalition was part of a larger coalition. We connected with a lot of folks to be able to get the city to deny the permit. What it took to win. So this is a result of 3.5 years of organizing efforts. So a lot of folks realize, have heard about General Iron maybe in the last year that before the win, but really this started 3.5 years ago. We had rallies, we had press conferences, calling on the mayor and the Chicago Department of Health to deny the permit. When we had about 200-300 people attending the city hearings on approving the permit during COVID. This was at the very beginning of COVID, and our communities don't have a lot of access to internet. So the fact that we had 300 folks on for a city hearing back in July 20, I think that was 2020. Is there 2020 or 2021? I can't remember. But anyway, we had a lot of folks on the call, and that's a big deal. When our voices were not heard at that point, then we started doing actions. Our Youth Leadership Council held one of the first actions on General Iron demonstration. They called upon the alderwoman to support the denial of the permit. When that didn't work, we did demonstrations by the mayor's house. And then after that didn't work, then we had a 30-day hunger strike, which is kind of what brought national attention to the cause. And then we did some more actions after that to continue to put pressure on the city to deny the permit. As a result of all of our work, we had the city for the first time had health impact assessment hearings where the community got to weigh in on health. While that could have gone better, it was those health impact assessments that led the city to deny the permit, not only because of the history of the air pollution, but also the impact on the health of the community. We also, the hunger strike also resulted in pressure from the US EPA to weigh in. In fact, the US EPA Administrator Michael Regan recognized the significant civil rights concerns and environmental justice concerns proposed by the General Iron site. And it was because he stepped in and one of our leaders, as well as a number of environmental justice leaders, met with him, and he came out with that statement, and that's kind of what led the city to halt the permit process, hold the health impact assessments, and then finally deny the permit. So it took a lot of work. This wasn't an overnight thing. It did not happen in a vacuum. There's a lot of context to this, but I think, one of the reasons we were really strong is our coalition is, multicultural, multiracial, and intergenerational coalition. We worked with environmental justice partners like the Southeast Environmental Task Force, who were really good at bringing in a lot of the other environmental justice partners throughout the city, but also nationally. And it took a lot to win. Yeah, I mean, you can tell, the hunger strike was kind of our last ditch effort to stop this from happening. And it's not something that I would recommend, but that was the thing that kind of pushed it over the edge. And that's at the point that we had that. And I forgot, right before the health impact assessments, we also had one of our staff members and 3 other leaders were arrested for civil disobedience. So like this was the extent that our community had to go to just to be able to deny one permit from one company, of a company that already had a history of pollution violations, but also the community where they were at had been fighting for years to get rid of them. And so if it wasn't good for their community, why was it good for our community? And so that was kind of, that was the whole fight. So I'll say more because there is a lot of follow-up after that, but I'll wait for the next round of questions.
No, thank you for sharing all of that. And really what I'm hearing is a long coordinated effort and different actions you had to take. You had your, you knew what you wanted, just again, like this one permit and how much had to go around it. And it sounds like you were able to work in partnership and really learn the different strengths and spaces of different organizations and coalitions and people, and all work together and choose different actions. And also just so incredibly upsetting that folks literally felt that they needed to make this point clear to go on a hunger strike and put their own body and health and survival at risk to make someone pay attention. And that shouldn't be the case. And so what can we all learn from these coordinated efforts so that we can work better in partnership together for our fights, so it doesn't have to be this hard? And so, Abby, I'm going to pass it back to you. And also feel free to just respond to that. But with all of this, how do you come out stronger? Maybe you win the issue, but how do you make sure you come out stronger? Because, like you said, this isn't the end of your fight. There's so much more, even for this specific Medicaid expansion fight in North Carolina, there's more to go. So how do we keep people energized, strong?
Right. And I think I've been talking to a lot of our free and charitable health clinics, and, this isn't going to end the number of people uninsured in our state. We're still going to have another 600 to 700,000 people without access to their own coverage. But to make sure that we come out stronger, primarily, I'm really focused, and I think Care for Carolina is really focused on how do we've waited this long to have expanded Medicaid in our state. Let's make it one of the strongest Medicaid programs that we can, that's out there, that really does a lot of work to get people enrolled sooner rather than later, so that we can have people really access the benefits of what we've been promising, which is when you have access, you can get treatment, and we can see some cost savings, and people can be linked to their primary care providers. So in that end, North Carolina has been a really strong coalition state, but just to have another example of a coalition, a much broader coalition, is what we're really focused on. For the legislative side, we really focused in more of our rural communities, leaving out our urban areas, where the big population centers are of people that need access. So I think that's how we're going to get stronger, is to get deeper into our communities, getting more people networked together to have a strong Medicaid program. And I think these connections are going to be what helps us move us to that next issue, whether it's that next healthcare issue that we're all really engaged in. So that's quicker than you probably thought, Allie, but
no, thank you. And Shaina, I see you come up, please.
Yeah, I can just jump right in. Like, I think, similarly, it's about the connections, and, it's about the friends we make along the way, is how we continue to build and to grow. And I think, although we're a global organization, the scope of our work is really just on insulin access and affordability, right? On patients with diabetes, working on prescription drug prices. And so that's pretty small, but our theory of change is just like so much bigger than us. We believe that by working on insulin access and affordability, we can build the power that we need to be able to move structures. For so many, affordable and accessible insulin is just an example of everything that's wrong with the prescription drug pricing system in America, and just like the healthcare system in America overall, and pharma's power and corporate profits. And so we just want to leverage this political moment and the specificity of this like life and death issue to really just build a wider coalition of patient advocates and advocacy partners working to affect change, not just for patients needing access to insulin, but for everyone who struggles with accessing the healthcare that they need. And so, I like didn't go into like some of our tactics in the same way that Abby and Amalia did, apologies, but like we do our own independent research, right? So we try to get independent data out there, including our access survey, a global access survey. We do like inside game, we do both inside and outside game tactics, right? So we do lobbying work with legislators, administrators, like develop ongoing working relationships with these decision makers to really build like trusted partnerships, and to ensure that we're developing policies that reflect those who are most impacted and can lead to like actual meaningful direct change. We actually should say, like, we don't engage in electoral organizing and candidate education efforts, and we really try to keep relationships with folks across the aisle at the state and at the federal level, really keeping this issue nonpartisan, keeping it motivating. But yeah, and we also meet with decision makers directly, doing shareholder activism, meeting with CEOs, and then also just like collaborating with that cross-sector stakeholders, kind of like what Abby was just saying. So we trying to work with other independent patient advocacy groups, demographic specific diabetes groups, other access to medicines groups, law firms that can file amicus briefs for us, really, trying all of the different avenues and all of the different relationships to be able to cross-pollinate ideas and share information and to take action together. And we have some like ethical collaboration principles as part of that too, which I can share. And then, we also, hold actions. And so by having these in-person and online direct actions, trying to force the opening the door of negotiation. So we have like a big email list, and we're building out, and also just doing like media and social media, and just work to disseminate that key information and those messages. So yeah, I just think like what's next is like, I feel like we have the movement, like we have the power, and we have for a while now. People unequivocally want to support insulin for all. And so I think it's a matter of politicizing and to say that people still believe in this hierarchical theory of power, where we want to shift people to understanding more of like a social view of power, where policymakers are held at the bequest of constituents, not big pharma. So we have these kind of concrete demands to target power holders, and we're also kind of building the narrative and the symbolic demands to be able to like change the weather and to move move the movement. So I'll stop there.
I think for our campaign, I agree, is all the partnerships that were formed throughout the campaign. I remember like the very first thing that we did was with SETF and ASE leaders protesting outside of at the time, the General Iron location, Lincoln Park. But I think during the campaign, we also engaged our Youth Leadership Council did a lot. They had their own rallies. They had their own petition. They did they led a lot of the chants and gave testimonies during the coalition, the larger Stop General Iron Coalition events. I know that's the Southeast Environmental Task Force already had environmental justice partners, but we also formed those connections because of this campaign. And I would say that there are a lot of folks that were engaged throughout the city of Chicago and even nationally in things in the for the hunger strike, because we had one of our staff members was one of 3 long-term hunger strikers, 30-day hunger strike. But we also had a lot of folks that participated in one-day solidarity strikes. So I definitely say it's the partnerships that were formed through it. We also helped redefine what good development means. So at the beginning of the General Iron campaign, and still for a lot of developments, the number one thing that the city or the company tells you is it's all about jobs. And so for us, this wasn't about jobs. This is about the health of our communities. This is about the pollution and health impacts. And the environmental racism of concentrating toxic companies in minority and already overburdened communities. So I think that's also something that made us stronger, was redefining what good development means. And then also, HUD recognized the environmental racism of the city, continually locating toxic companies in minority neighborhoods. And then our leaders have made connections with other communities fighting for the same thing. So Hillco, which was the demolition of a stack that led to a toxic cloud over part of our community, little village community, not ours, but one of our sister communities in Chicago. And so it's a toxic cloud over the community. And that happened right before General Iron. And so folks were already talking about that when General Iron was proposed. Folks have recognized the similarities with Sims, which is a recycling center that was being proposed in Little Village. They recognized other toxic developments across the city of Chicago. So, and have been acting in solidarity with partners, just like they acted in solidarity with us to protest the permit for General Iron. And then right now, because of the recognition that this is all related and that we're not in it alone, and that despite our General Iron win, which does show what a community can win, that there's still toxic developments that are being proposed for the Southeast side and other environmental justice communities throughout Chicago, our state, the US. And so our leaders are currently fighting to get a city ordinance on cumulative impact, trying to push for a state and federal policies on cumulative impact. So cumulative impact just means that instead of just looking at the permit, which is what the EPA does, what the claims are in the permit, the cumulative impact means taking into account the total amount of air pollution already existing in the area. It means taking into account the health impacts in the area. It means taking into account the socioeconomic impacts in the area. And it also means taking into account the racial impact, racial disparate impacts in the communities. So that's been very important. And so that's kind of what we're doing right now. So that's how we've come out stronger. I would say developments in the city of Chicago, you know, people are talking about health now. People are talking about environmental justice. And previously it was just jobs. How many jobs can they offer? And so I think redefining that, growing the number of partnerships. And then, like I said, we found bigger things that we need to move so we don't keep having to do this fight.
You transitioned me so beautifully into my next question, and I'm recognizing time, so I don't want to speak too much, but the big question, so now what? And do we move on to the next issue? Is there still more in this fight? I'm starting to get the hint from what you're saying. And what do you need from all of us here to keep this going? Abby, I'll pop it to you, and maybe you can also speak to Wendy's question.
Oh, great. Amalia, if you wanted to go first just to answer that too, I'm happy to wait.
Okay, well, yeah, since I teed it up, right? Actually tomorrow we're going to Springfield, which is Illinois' state capital. So tomorrow we're going to Springfield. We are advocating in support of something called the Illinois Environmental Justice Act, HB 2520. It would prevent future general irons, and it is a statewide cumulative impact policy. So if you are in the state of Illinois, I'll put next steps in chat, but we could really use support to get it through the House, which will happen either today or tomorrow, and then the Senate. So we're asking folks, Senator Harmon has not called it for a vote. So we do want him to, when it comes out of the House, for him to support it, call the bill, which he has not committed to doing, and passing the bill through the Senate so we can do this. This is the second year that we've tried to do this. And then I also have a link for folks to send to their legislators, state and Senate legislators. For those of you who are not in Illinois or your representative organization who may be interested, we are working on a sign-in letter. So if you want to DM me, and we'll send you a sign-on letter in support of the Illinois EJ Act. The other thing that everyone can do is that the US EPA has a national proposed cumulative impact policy. While there is a lot that it could delve into a bit more specifics, it has a lot of things that are not being proposed at the city and state levels right now. And so it is by far the best thing that we have. So I think if anyone is meeting with the US EPA, just, letting them know that you support the proposed policy. So those are kind of the next steps, and I'll put them in chat.
Yeah, I just was listening. We've had a lot of issues with PFAS here in North Carolina, and the NPR story about sludge. It's just, there's so many directions that we can go and after this, and it's such a good lessons learned. Thank you. To the question, taking Allie's question and putting it towards our work, and Wendy, that was a great question too. So for the redetermination and the unwinding of the public health emergency, which all of those individuals that were able to access Medicaid during the pandemic are to be rolled off later this year, and I think in some instances starting even next month. So that was actually part of the urgency that we were able to talk through with our legislators about what an impact this was going to make on our counties and our county budgets. So either they were going to be transitioning people to the social services departments were going to be taking on the unwinding, or and then the health departments were going to be overrun with people trying to get access to care. So we really focused in on why the expansion needs to start happening now so that it can be an easier transition. While a lot of the details are still in flux, it's my understanding that they're going to, in North Carolina, delay that population so that, and the redetermination of that population so that they'll be able to access and have a soft landing into expanded Medicaid if they are part of the qualification. So, and so we have really been working towards that. Has been some of our messaging as well, and hopefully going to be working with the administration to really amp that up, that those will be some of the first people to qualify. And I think that's part of our next steps, really continue to build our coalition. So if there's any of your groups have members in North Carolina that are a chapter in North Carolina, we'd love for them to be a part of our stakeholders so that we can continue to get information out, because it is so critical, and think of ways to engage. That's what our big focus is going to be, just getting, again, deeper in those communities so that they can engage in the process.
Yeah, a little bit different on our side, I think, than some of the things that folks have been talking about. Maybe that's because it's federal, maybe there's other reasons, I'm not sure. But as I said at the top, we really need to pass policy to lower the list price of insulin for all, and just to start that actual disruption of power that pharma holds over policy. So we really want to pass a cap to the list price of insulin. And so, that hasn't been politically possible because of, pharma's oversized presence on the Hill and things like that. So if that's not going to happen, if we're going to do it a copay cap, it needs to include the uninsured. We need to make sure that doesn't just spread costs among premium holders and pad pharma's bottom line, but that it's actually for everyone, and that it's has that price cap components for including the uninsured as well. But I think just overall to say too, I don't think we're winning overall. There's so much more to be done in the movement. And just turn the lens on funding real quick. I think funding sources are acting like the Access to Medicines movement has won with the Inflation Reduction Act, and that the Access to Medicines movement has a lot more work to do to really bring together the lived experiences and leadership of independent patient advocates, and to be funded like it's going to win. So I think strategically, we really want to take back the narrative from pharma's benevolence back to policy change. And then alongside with that, arm in arm with that, is to take back the narrative from copay caps to list prices. We have only won a reduction in list price for a few insulins at a little bit. And I think patients are starting to realize that even though the Medicare $35 a month copay cap is in effect, it's not for all insulins. It's just for certain ones. I think we're starting to hear from patients saying, I thought this was going to reduce my copay, and I'm still having to pay thousands of dollars a month. And so we need to really fix this copay narrative loophole before we pass new laws that kind of continue along those same problems. And then also just to keep up the issue of drug prices writ large as this issue that everyone agrees with, that it's bipartisan, that it's winnable. We're getting great policies written in all sorts, in states all across the board. And, Josh Hawley was the first one to introduce insulin legislation this session. So just really wanting to keep it available for everyone to be able to champion. And that's not to say that this issue of insulin can't deliver really significant wins in 2024. And even if we do pass a copay cap in Congress, the administration can implement that in a lot of different ways. And we want to make sure that if there is an insulin copay cap, that it won't just fork over tons of money to pharma, but that we're actually putting into effect some price caps as part of that implementation. I have like a lot of other like nitty gritty stuff. I feel like it's the end of the call and I'm losing folks. So let me stop there. But, also there's so much exciting stuff happening with public production that's really changing the narrative on what prescription drug pricing and, access to medicines and access to healthcare can look like, of California having a collaboration with Civica RX, needing to expand that to other states, need to make sure it's available and affordable like yesterday, but we'll take what we can get. So we'll not take what we can get. We'll take what we can get and run with it and keep pushing. So thanks.
Oh my gosh, thank you so much to the three of you for taking the time to share all of this wisdom from so many different fights and landscapes. And I'm sure so many people here were like, wow, I could definitely do that. Or we do that too. And we work in a completely different setting. And I think that's what's so beautiful about this space and bringing us all together to learn from each other. And I hope you all follow these groups here that these folks are representing. Please, we will send out all the resources. I will start wrapping things up, but if you could fill out the form in the chat that Lucas put in. Yeah, thank you so much, Amalia, Abby, Shaina, for taking the time to join us today, for sharing what you've learned and what we all need to do to build the power of our movements and to win. I just wanted to give folks a few more reminders. One, we said this at the top, but just want to say it again: medical abortions and attacks on Medicaid, Medicare, Social Security through the debt ceiling and the budget. We all have to be part of these fights. We have to be part of the fights of our panelists as well. Our fights are intrinsically related to one another and look beyond the topics that we discussed today and include the topics that we discussed today. There's so much more activity going on than we know it, than we all know on this call, than PIH knows about. So if you think that we should know about what you are doing and what you think other people should know about, please email me. I'll put my email in the chat, but abloomgarden@pih.org. Again, before you go, please fill out the survey in the chat so we can better cater these calls to your needs, and have a happy rest of your Tuesday. Please stretch and breathe and take some time to reflect on where we've been and actions for where we're going next. And we look forward to see you on the next call on Tuesday, June 27th at 1. So please sign up and we will see you then.
Have a nice day. Thank you.
Bye, y'all.
Thanks. Bye.
Bye, folks. Thank you so much.
Thank you. Have a great day.